very generous introduction. Your Grace Archbishop Mar Andrews Tharth, Mrs. Kulnar Adenwalla, our awardee and honoree, Dr. Ajit Ronald Gurbachan Singh, the many other respected dignitaries here, distinguished professors, faculty, teachers, doctors, dear students, friends, I hope that covers everybody. എല്ലാവർക്കും എൻ്റെ വിനീതമായ നമസ്കാരം. It's a profound honor to deliver the Dr. H.S. Adenwalla Memorial Oration at Pelecanus 2025, an occasion that carries clearly both solemnity and celebration. We gather not merely to recall the past with reverence for this great individual we are honoring today, but to recommit ourselves to the timeless vision that animated him and the Jubilee Mission Hospital, a vision of compassion, service, and healing for all. I've been honored by Mrs. Adenwalla putting a sash on me, and I couldn't help notice that on the sash are the words, service with love. That is not something you find in too many hospitals. And that, I think, in many ways, is going to encapsulate the theme of this oration today. When Monsignor Matthew Muringateri laid the foundations of Jubilee Mission Hospital in 1951, his dream was not of a profit-making venture, but of a sanctuary where the suffering poor could find refuge. He believed with gospel simplicity and prophetic foresight that healthcare must not be chained to economics, but dedicated to service. His motto, transforming lives with love, was no mere slogan. It was an ethic, lived daily, carried in the footsteps of every nurse, every doctor, every attendant who looked upon a patient not as a burden, but as a fellow child of God. Dr. H.S. Adenwalla embodied that founding vision with astonishing brilliance. Born in Ahmednagar in 1930 and trained in Mumbai, Dr. Hirji Sorab Adenwalla was a polymath in medicine, a surgeon, a teacher, a humanitarian, and a visionary. After turning down an opportunity to work with Dr. Albert Schweitzer in Africa, he chose instead to serve at the Jubilee Mission Hospital in Thrissur, arriving in 1959 when it was still a fledgling dispensary. Over the decades, he transformed it into a beacon of surgical excellence, especially, as we saw in the lovely video that began the evening, in cleft lip and palate care, where his innovations earned global recognition. He was a founding figure in India's cleft surgery movement, revered for his technical brilliance, compassionate care, and unwavering commitment to the poor. Patients knew him as the Sahib Doctor, a man of humility in khaki shorts who treated all with dignity. His legacy lives on in the Charles Pinto Center, in the thousands of lives he healed, and in the ethos of service he instilled in generations of caregivers. Over 6 decades of unwavering commitment, he performed more than 23,000 cleft lip and palate surgeries, each not merely a procedure, but a restoration of dignity, hope, and identity. His partnership with Smile Train was not about statistics, not about international acclaim. As we heard from Dr. Benny, he never looked for acclaim. It was about affirming that the poor child in Thrissur was every bit as deserving of care as the privileged child in New York or London. Dr. Adenwalla's life reminds us of a profound truth. Excellence in medicine is measured not merely by technique or scalpel, but by the depth of love with which it is offered. Once again, the sash speaks. Service with love. So I'm proud to stand here and address you all today in the hospital in which he served. Founded in 1952 by the Catholic Archdiocese of Thrissur, Jubilee Mission Hospital has grown into one of Kerala's most respected medical institutions, and if I understand correctly, its #1 ranked medical college. Today, it is a 1,500-bed multi-specialty hospital, a full-fledged medical college, a nursing college, a school of allied health sciences, and a thriving research institute. Still known locally as the Poor Man's Hospital, it has never wavered from this motto of service with love. Jubilee Mission provides super specialty care at subsidized rates, trains hundreds of medical professionals annually, yes, some of whom I addressed here in 2007, 18 years ago, and it has become a referral center for patients from across central Kerala. Its aspirations are bold yet grounded to expand its outreach to rural communities, to deepen its research in public health, and to continue being a sanctuary where no patient is turned away for lack of means. It stands as a living testament to what faith-based service can achieve when guided by compassion and competence. And the name Pelecanus, as Father Rennie has told us, encompasses themes of sacrifice, of care, of protection, of community, and of nurturing, so appropriate for the mission of the Jubilee Mission Hospital. Today, however, we meet at a crossroads. Healthcare has made astonishing progress. Genome editing, AI-aided diagnostics, robotic surgery, personalized medicine. Miracles unthinkable a generation ago are today daily realities. Yet these marvels unfold against a backdrop of deep crisis. Mutating microbes, pandemics like COVID-19 knocking at our doors, brain-eating amoebae in our freshwater bodies, zoonotic spillovers from a fragile environment, lifestyle diseases born of consumerism, and the cataclysm of climate change disrupting the very conditions for life itself. But for the ordinary citizen, perhaps the deepest wound is not disease itself, but its cost. The corporatization of more and more of our private hospitals has created an emphasis on revenue, where the accounts department is more important than the medical treatment. Corporate pressure to increase revenues has outstripped the emphasis on care and cure. Forget about love or service. Too often, a family struck by illness finds itself struck doubly by ruinous debt. Hospitals rise as glittering citadels of technology, but their doors open more readily to the wealthy than to the weak. Bills expand faster than hope, and we are left to ask, will the future of medicine be a story of healing or of exclusion? This is the danger of a purely corporate presence in healthcare. When profit becomes the compass, ethics stumble into the shadows. We see this in overprescription, in doctors pressured to order unnecessary procedures, in the transformation of suffering into market opportunity. Can compassion survive in such a climate? Can corporate culture ever substitute for a physician's personal touch? Can spreadsheets calculate the tears of a mother, or balance sheets capture the smile restored to a child's face, as Dr. Adenwalla so often did? The era of corporate profits is at odds with everything he stood for and lived for all his life. And yet corporate institutions have one notable advantage. They can marshal immense financial resources to invest in cutting-edge facilities, medical technologies, and advanced research. Many breakthroughs in cancer care Cardiac interventions and robotic-assisted surgeries were made possible precisely because corporations had the means to build state-of-the-art laboratories, sponsor clinical research, and attract global expertise. This capacity for investment, if rightly harnessed, can complement the missionary ethos and strengthen our healthcare ecosystem. The challenge for us, therefore, is not to reject corporate participation, but to ensure that the resources of the corporates are directed towards equity as well as excellence, that excellence and compassion can truly coexist. What, after all, makes human beings compassionate, even towards other creatures that share neither our tongue nor our form? Science offers one part of the answer. Deep in our brains, as some of you students here certainly know, mirror neurons fire when we see another in panic or in pain. Oxytocin flows, prompting trust and nurturing care. Faith offers another. This is no mere accident of biology, but the stamp of the divine upon us. The command to love, to show mercy, to see the sacred in the face of every other. Thus science and spirituality converge. Compassion is not weakness, but the highest expression of humanity. Civilization itself was built on this foundation. Empathy forged community. Love sustained societies. To feed the hungry, to heal the sick, to shelter even a small bird from the rain, these are not luxuries, but the bedrock of moral progress. Without compassion, civilization is but machinery. Without love, humanity is mere arithmetic. In this light, the missionary concept of healthcare is not quaint nostalgia, but still an urgent necessity. To appreciate this, let me step back a little into church history. The contribution of Christian missionary institutions to India's healthcare landscape is a legacy of quiet transformation. From the mid-19th century onward, missionaries, particularly from the Catholic but also from the Protestant tradition, played a pioneering role in bringing organized medical care to regions that had long lacked access. In Kerala, this legacy is especially pronounced in institutions like the CMS Hospital in Kottayam, founded as early as 1834, which laid the groundwork for a tradition of compassionate service that continues to this day. Across Travancore, Cochin, and Malabar, the church established hospitals, leprosy asylums, and general clinics that served not only the faithful, but the poor and the marginalized of every caste and community. The Carmelite, Jesuit, and Franciscan congregations were instrumental in this effort, not merely as benefactors, but as builders of systems, training nurses and midwives, organizing community outreach, and embedding healthcare within a broader ethic of dignity and service. St. Joseph's Hospital in Manantawari is just one example of how these institutions became lifelines in remote and underserved areas. In Kerala, as we all know, the Catholic Church's role in healthcare is far from history. It is a living, still evolving mission. Hospitals like Lizzie in Ernakulam and this wonderful Jubilee mission in Thrissur have become synonymous with ethical, affordable, and yet high-quality care. They have nurtured generations of caregivers, many of them women, whose quiet professionalism has uplifted entire communities. These institutions have also embraced modernity, integrating advanced medical technologies while retaining their core commitment to service over profit. Kerala's Christian medical institutions remain pillars of public health, blending clinical excellence with a deep ethic of service. Across the state, over 35 nursing colleges and dozens of hospitals are run by church bodies such as the Catholic Health Association of India, CHAI, the Kerala Catholic Bishops' Council, KCBC, and various other congregations, including Orthodox and Protestant. These institutions are not only known for their affordable and ethical care, but also for pioneering nursing education, especially for women, and for reaching underserved populations in tribal and coastal regions. From Caritas Hospital in Kottayam to Pushpagiri in Tiruvalla, they have built reputations for clinical integrity and spiritual compassion. Their graduates serve across India and abroad, carrying forward a legacy of healing rooted in humility and human dignity. In an era where healthcare is increasingly commodified, the Church's healing ministry stands as a moral compass. It reminds us that medicine is not merely a transaction, but a vocation. That the sick are not mere clients, but fellow human beings deserving of our empathy and care. As we look to strengthen India's public health systems, we would do well to remember and to honor the foundational role played by these missionary institutions, whose legacy is written not in headlines, but in lives saved and suffering eased. The relevance of this approach today is threefold. First, accessibility. Mission hospitals remind us that care must prioritize the excluded, not the affluent. This ethos laid the foundations for India's post-independence medical missions, from rural health initiatives to tuberculosis campaigns, and remains essential if we aspire, as we should and must, to universal health care for all Indians. Second, holistic service. Corporate medicine, as I said earlier, is often procedure-driven, but missionary medicine is people-driven. It heals not only the wound, but the whole person, addressing body, mind, spirit, and community together. That is holistic service with love. And third, ethics over economics. Dr. Adenwalla, Dr. Valiathan, Dr. Keshavan Nair, countless others, I don't want to single out specific people, they've all proved that compassion and competence are not opposites, but allies. The missionary model insists that empathy enhances excellence rather than diminishing it. It is therefore vital for our country to maintain both a strong public sector healthcare system and a robust missionary network. Together, you create the safety net that corporate institutions alone can and will never provide. The public sector ensures reach, scale, and equity, while missionary hospitals rooted in service address their needs with compassion and a human touch. In Kerala, much of our state's enviable health achievements, our high life expectancy, low infant mortality, and extraordinary primary healthcare penetration owe as much to the Christian missionary hospitals as to government policies. The Christian missionary hospitals pioneered medical education, maternal care, and specialty services when other institutions were still absent. And they continue to carry the legacy of reaching the most deprived. Without their contribution, the Kerala model of health would be incomplete. So when we boast today, as we started doing from last week, that our infant and maternal mortality rates in Kerala are actually better than those of the United States, which is true, let us salute the Church as well for its pioneering role in making such a record possible. Equally transformative, of course, was the Church's role in education. Missionaries introduced modern schools that opened the doors of literacy to marginalized communities, Dalits, fisherfolk, women who had long been excluded from learning. The CMS College in Kottayam, 1817, the first Western-style college in India, became a cradle of higher learning, while mission schools across the states accelerated Kerala's literacy revolution. Girls' education in particular received a huge boost, with convent schools providing opportunities that shape generations of teachers, nurses, and social leaders. The synergy between education and healthcare created by these missions helped Kerala achieve what became known as the Kerala model: high literacy, low infant mortality, and life expectancy levels rivaling the developed world. I would particularly wish to commend the Church's role in promoting medical education, emphasizing that the practice of medicine is not merely a profession, but a calling, and how fitting that Jubilee Mission, where we stand today, is indeed widely hailed as the best medical college in the state. But new hurdles constantly emerge. The COVID-19 pandemic revealed the fragility of even the strongest health systems. It exposed staggering and surprising inequities in access to treatment, the vulnerability of migrant workers, initial shortages of personal protective equipment for doctors, including such basic items as masks and gloves, problems in obtaining sufficient supplies of oxygen, and the crushing strain on doctors and nurses, and on some hospitals even for adequate space. COVID-19 will not be the last of our pandemics, and the challenges it revealed must be confronted and resolved before the next pandemic hits us. As pathogens mutate, as traffic between species accelerates, and as climate change disorients entire ecosystems, public health must now battle on multiple fronts simultaneously. This is where the One Health vision becomes indispensable, recognizing that to cure humanity, we must also cure our relationship with nature. The next pandemic may emerge from who knows where, melting permafrost, vanishing forests, or a laboratory mishap, who knows? Our preparedness must rest on networks that integrate public institutions, global collaborations, corporate investment, and missionary hospitals that can reach the grassroots when the next crisis strikes. Let us be clear. Technology must serve humanity, not replace it. Artificial intelligence may read an X-ray in seconds, but it cannot listen to the fear in a patient's voice. Robotics may perform a delicate surgery, but it cannot wipe away the tear of a suffering child. Hospitals must remain sanctuaries of compassion, not cathedrals of commerce. India's aspiration must not be a two-tiered system, glittering hospitals for the affluent and empty promises for the poor. We must find the balance between science and spirit, between investment and ethics, between corporate profits and the missionary ethos. Let us remember, a hospital without compassion is but a building, and a doctor without the spirit of service is but a technically qualified salesman. But when science is infused with love, when healing is infused with empathy, medicine rises to its true dignity, not as a career, but as a calling. In honoring Monsignor Muringatheri's vision, in recalling the genius of Dr. Adenwalla, in saluting the living labor of Dr. Ajit Gurbachan Singh, we are called to rededicate ourselves today to that central mission of transforming lives with love. That mission must flow not only through missionary hospitals, but through every institution of care in our country. The true test of any civilization is how it treats its weakest members. Mahatma Gandhi reminded us of that. And how wisely it guards the earth that sustains them. Today's ecologists remind us of that. If we marry the miracles of science with the ethics of compassion, if we harness corporate efficiency without extinguishing missionary love, then perhaps we may not only conquer disease, but heal humanity itself. Thank you for giving me the great honor of addressing you today, and Jai Hind.
Thank you, sir, for your thought-provoking oration, which enriched our understanding of the critical topic, service with love.